So when talking about pain management, there are a lot of things that a practice could do to kind of elevate their game or get a gold standard. But one of the simplest, cheapest for your practice that you can do is local blocks. So if you're not doing local blocks on your patients, you really should be doing them for every surgical procedure. For anything from spays, just doing a line block along the incision makes a huge difference. Dentistry, anytime you're taking out teeth or taking a biopsy of a growth in the mouth, you want to be doing a local block. It's going to change the way that you practice anesthesia because you're going to use less inhalant anesthetic overall, right? So we know we get into these dentistries, and if we're not blocking, we start to take the tooth out, and then what happens? That patient starts they start waking up under anesthesia because those pain signals are going to the brain. Well, if we put a local block in place, we eliminate those pain signals going to the brain. They're not needing more inhalant anesthetic during the actual anesthesia. And then if we don't have as much inhalant anesthetic on board, we're seeing less hypotension. And in these old decrepit cats that need 13 extractions, we don't want them on an isoflurane level of 4 or 5% because we know that's detrimental. So if we do balanced anesthesia, an opioid plus a local block plus a little bit of inhalant anesthetic, we can make that procedure safer for the patient overall instead of a whopping dose of inhalant anesthetic. So if your practice is not doing local blocks, I would suggest getting educated on local blocks. Again, there are many resources online that will talk about different local blocks. There are a lot of good books out that will look at local blocks. Pain management for the veterinary technician, where Mary Ellen Goldberg is the editor and Nancy Chaffron's one of the other editor, is a great resource for technicians who are interested in pain management, and they have a whole chapter on local blocks with landmarks and everything from sacrococcygeal blocks to dentistry blocks to epidurals, everything you could need local block wise.